So we are live. Hi, my name is Catalina Blanton. I am a first year clinical psychology student here at Midwestern. I am here with the esteemed Dr. Angela Breitmeyer, who is a professor here at Midwestern and also has a license in psychology here in the state of Arizona. So thank you so much for being here today and imparting your knowledge and your experiences that you've had as a sports psychologist. If you guys have any questions, please write them in and ask away. That's why she's here. So what can you tell us a little bit about yourself and how you got into this field to begin with?
Sure, of course. Well, and first I just want to let you all know that the 3-minute delay was an opportunity all to get you into the right appropriate space and frame of mind for the interview today. Mindfulness actually is a big component of sports psychology. What we typically find is that what's happening in clinical psychology impacts sports psychology and vice versa. So in terms of how I specifically got interested in it, it wasn't until I was older that I discovered it. I wasn't the best athlete when I was younger. And in hindsight, I wish I would have known some of these principles of sport performance enhancement in order to improve my athletic performance.
Wow. So it's through your own personal experience that really inspired you to take this route, it sounds like. Yeah. So can you tell us a little bit more about the discipline and the history of sports psychology?
Sure. So in terms of the discipline, it's really evolved. In 1985 was when the Association of Applied Sports Psychology was formed. Now I can tell you within the American Psychological Association, our division 47, we've expanded beyond sports psychology. And so our division is now known as sport performance and exercise psychology. So we're really attempting to diversify the field, diversify the profession, and include not just athletes as performers, but also performing artists, surgeons, individuals in high demand professions. So all of that is included under the purview of this newly formed Division 47 Sport Performance and Exercise Psychology. In terms of my role, I see myself as a psychologist first and foremost. So that informs my approach to whether it be I'm working with an athlete or a regular client, that is how I see my clients from that clinical lens. So very holistic, very comprehensive. I leave no stone unturned, so to speak, in terms of doing my assessment. So I feel like my background, my experiences, my training clinically has really helped me to be a better clinician when I'm working with teams and athletes.
Okay. So yeah, segueing off of that and your work with athletes, can you tell us a little bit about the roles and responsibilities you assume as a sports psychologist?
Absolutely. I think one of the things that's really important is that within the realm of sports psychology, sometimes your role can get muddied because especially if the coaches hire you or the team or the organization hires you, then they're your client, right? And so it's always navigating more of those complex ethical issues of still attempting to have confidentiality with your athletes when they disclose or share something to you individually. And how do you handle it if it is something where maybe you have to bring a coach into the mix, for instance. So, I mean, I think it is challenging, and you never know what an athlete's going to bring to you. NCAA has rules and guidelines about certain parameters. I remember a particular issue of I had one of the athletes I was working with had a diagnosis of ADHD and was prescribed a psychostimulant. Okay. And so here's where we see a clear overlap between clinical psychology and understanding, hey, this individual needs medication to function in everyday life. And gosh, NCAA has these restrictions about what substances the athletes are allowed to use. So, how do you have conversations with athletic departments? How do you help inform policies? All of that becomes very important, and probably something that, the average individual might not necessarily even think of. I mean, it wasn't until I had the experience at the College Counseling Center that I really thought about some of these things.
Wow. So not only do you have to, respond to the division, but also the NCAA parameters. So what is that process like as far as getting licensed and getting into this field? Because it is like is it a subspecialty within the field of psychology?
I'm glad that you're asking that, Kathy, because in terms of what we think of when we think of the broader field of sports psychology, there's what's known as mental performance consultants or sport performance consultants or mental skills trainers. Okay. These individuals typically have a master's degree in sports psychology. Okay. And it doesn't necessarily mean that they have a counseling degree or a social work degree or a clinical or counseling psychology degree on top of that. And so I think it's really important for the public to be informed in terms of, which clinicians are appropriate to treat what specific issues or concerns. One of the reasons why I went the route that I did is that I'm able to kind of do both. I can do both the performance enhancement work, and then I can also work with an athlete on a clinical issue such as depression or generalized anxiety. In my experience with athletes, the delineation between a sport performance issue and a clinical issue isn't often clearly defined. So I can't tell you how many times an athlete will come to me and say, hey, I really want to improve my concentration or my focus in a game. And what I realize is, oh gosh, they could potentially have ADHD, or gosh, this isn't just a focus or attentional issue. This individual struggles with anxiety more broadly. Okay. And so what oftentimes happens is if they come to me for this specific referral question, or they want to see me to help improve their sport performance, and then I see something that's clinically getting in the way, I feel like as an ethical psychologist, I need to tackle that clinical issue first. And then the sport performance issue becomes more of a higher order need. And so to draw a parallel to what a lot of psychology students learn about in graduate school, that Maslow's hierarchy of needs, right? Where we have at the base, physical needs met, safety, and then it's not until we go up the triangle further that we can work on other aspects of ourselves. The same holds true within the discipline of sports psychology. I'm not working on improving an athlete's free throw percentage, for instance, if they're not getting out of bed.
Would you say that that's a major advantage of having a clinical degree?
I think so. I feel like it also helps inform just me thinking more broadly about an athlete's issue. I think about if an athlete comes to me and says, I'm really struggling with this issue on the court or this issue on the field, my natural inclination is to say, is it only on the court? Is it only on the field? Or do you have similar issues emerging in other areas of your life? Whereas somebody who has the background in sports psychology, they're going to stay in that scope of practice of only focusing really on what's going on the field, on the court, in the sport realm.
Wow. Yeah. So that's the difference, you would say, between a sports performance consultant versus a sports psychologist, is that clinical piece.
Correct. And okay. I mean, the term psychologist is a legally protected term. And so I know at our conference at the Association for Applied Sports Psychology, we're frequently discussing that very issue of, somebody has to be licensed as a psychologist in order to call themselves a sports psychologist. There is not a specific licensure for a sports psychologist.
Yeah. And why would you say that sports psychologists are needed, for those who are wondering?
Yeah. Well, I think sports psychologists are needed because psychologists are needed and athletes are humans too. I think that there's been a lot of talk in recent media about, athletes coming forward with some serious mental health issues. And I think that it's important for us as a field to advocate for them. I think that, in the past, traditionally, athletes have been held to this higher standard, almost seen as superhuman. And at the end of the day, they're still human. They're still prone to the experiences that we are in terms of having emotional distress, maybe if they're not at the elite level, struggling with paying bills or other sources of life stress, managing family, having all of those other aspects of their life that they're navigating. Now, I will say, one of the important pieces that I've noticed in my work with athletes is how important their athletic identity is to them. And so oftentimes I'll have an athlete seek out my assistance when they've experienced an injury and they're no longer able to participate in their sport. And so I can't tell you the number of times I've had an athlete say to me, it's not just a sport that I play, it's who I am. It's ingrained in my personhood. Like, this is a part of me. It's not going away. And so when an athlete is injured, that can be very demoralizing for them. It's almost like, what do I do with my life now? What do I do with my time now? And so in terms of strategies that I've used in working with athletes, I've talked about, well, have you explored your values outside of sport? Have you explored your interest outside of sport? Have you explored other aspects of your identity in addition to who you are as an athlete? And so that's oftentimes launched into some really interesting conversations with athletes.
Wow. So not only is psychology an integral part of, sports performance that I don't think people realize, but also ingrained in their identity and you helping them navigate new aspects of who they are. So in what other ways would you say psychology is related to performance that people are not aware of?
Sure. And I think, I know you and I talked about this previously, Kathy, when we met. But as I mentioned, we're broadening beyond just athletes. Okay. So firefighting, police officers, surgeons, the military, for instance. I know several of the military branches actually have a mental performance consultant on staff. They're specifically looking for performance psychologists to hire who have this particular skill set and this background and this experience and training. So we're really trying to broaden our lens in terms of the work that we do, in terms of the populations that we serve.
Yeah. And how do psychologists help facilitate that performance enhancement and all these different aspects of performing that you just described?
Yeah, so a lot of what we're talking about is standard mental skills training. And at least when I was trained, Kathy, we did a lot of cognitive behaviorally based interventions. So a lot of CBT skills training, things like cognitive restructuring, exploring an athlete's self-talk, aspects related to goal setting, visualization, relaxation, different types of breathing techniques. And because of the overlap between both clinical and sports psychology, kind of what's trendy now in clinical psychology is also what's trendy in sports psychology as well. So I know in clinical psychology, there's a big push for more mindfulness-based interventions. You're seeing that in the sport realm as well. More of the third wave cognitive behavioral approaches are frequently being implemented with an athletic population too.
Yeah, I recall you saying some of those cognitive reframes that I thought were so powerful. Do you mind giving us some examples of those?
Yeah. So one of the things that I think is enlightening for athletes to realize, or just people to realize in general, that our brain doesn't process the word don't. So if you say don't miss a shot or don't strike out, what your brain really hears is miss the shot, strike out. And so one of the most powerful techniques that you can give to an athlete is just getting them to explore their self-talk and state their thoughts in more of the affirmative, what they want to create rather than what they're trying to avoid. So rather than saying, don't miss the shot, make the shot, right? Rather than saying, don't strike out, get a hit, or, home run, or whatever the specific hit they're wanting. We are encouraging them to think about that outcome that they want to create. I think in general, we don't realize how powerful our mental space is, right? That, our thoughts can be our best friends or our worst enemies. And I think it's so important for everyone, not just athletes, to be able to learn some strategies to help manage that. Life's hard enough as it is. You don't need to be mentally beating yourself up over, missing that shot, missing the game-winning shot at the buzzer, for instance. And what makes an athlete more mentally tough, more resilient, what makes them able to get beyond that is, can they look at that experience and realize that even though it was painful in the moment, it's actually making them a better athlete. They have the opportunity to do better next time. And I think that oftentimes a book that I'll recommend to athletes is, Dweck's work, Carol Dweck's work on a fixed versus a growth mindset. And that's frequently discussed within the sports psychology literature that, do you have more of that fixed mindset where you're rigid, you're stuck in the past, you're not willing to move forward or be flexible or go beyond, versus that growth mindset? Can I take this experience and really learn from it and become better? And I think that, especially for elite level athletes, right? Where they're high level performing, they have social media accounts. People are posting all on their social media accounts. I actually had a conversation with a colleague not too long ago about this, like how many times the sports psychologist or the sports psychology practitioner will say, turn that off, right? Because sometimes it's helpful, and most of the times it's not.
Right. Wow. Yeah. And it's difficult to escape as an athlete, as you want to keep in touch or keep connected with the fans, but also managing your mental headspace and protecting yourself. So in addition to these, what seem simple, but they're so powerful, these little interventions, are there any assessments that you include or use when working with athletes?
I think that because I live and work within the realm of clinical psychology, a lot of the assessments that I have used with athletes are more clinically based. So I've administered something like a Beck depression inventory or a Beck anxiety inventory. Probably one of my more favorite sport-specific measures to use is what's known as a performance profile. And that's more if I'm working with an athlete from that performance enhancement perspective, where I have them look at aspects of their physical performance, technical performance, tactical performance, and psychological performance. And so I want them to look at those other domains, physical, technical, and tactical first, kind of like a parallel process that we do in clinical psychology, where we want to rule out anything medical first. I want to see if there's anything more going on from like a skill base that's obviously out of my scope of practice. Could it be helpful for them to have some extra coaching sessions, meet with a swing coach, for instance? Could it be possible to increase their physical training? Could it be possible that there are other members of the sports medicine team who are more relevant, like an athletic trainer or a personal trainer, strength trainer? And so we want to make sure that, if there's something more physically or even medically going on, that we're absolutely ruling that out first before we're considering something more psychological. And I will say, it's my clinical training that has informed me to kind of think more along those lines.
Wow. So it seems like a collaborative approach to helping one individual perform. Who have you worked with to collaborate with or collaborated with? I'm sorry.
Well, Kathy, confidentiality, right? So that's one of the ethical principles that I'm required to adhere to.
Mm.
So it doesn't matter even if I'm doing sport performance work. So let's say hypothetically I wasn't licensed as a psychologist. If I were certified through the Association for Applied Sports Psychology, those guidelines surrounding confidentiality still exist. So I'm still expected to uphold those. Okay. So, I'm not going to, obviously, like, you wouldn't name one of your clients that you see clinically. I wouldn't name one of my athletes either. And so that's something where the parallel is, I would say, almost exactly the same between sport work and clinical work, where that confidentiality in terms of maintaining your client's anonymity, maintaining that athlete's anonymity, that's of utmost importance. Now, I will say that, individuals, for instance, like Michael Phelps and Simone Biles, they have been very vocal about some of their mental health challenges, and they've almost taken a platform of, raising mental health awareness. And so it's really the athlete's right and the athlete's choice for them to decide who and when and how they share their story, because it is a very private and personal story. And I will say that, I think it takes a lot of courage for someone to say that they're not okay. I think, especially here in the United States, especially here in Western society, there's this tendency to sweep everything under the rug and pretend that everything's okay. And so I think with athletes coming forward, and oftentimes athletes who are revered and put on these pedestals, with them coming forward and saying, hey, this is something that I struggle with. My hope as a psychologist is that trickles down to society in general, and people start thinking, okay, gosh, if this individual is being vocal and having the courage to say, this is something that I'm struggling with, it might also give just I hate to use the term average Joe, but I'm going to use the term average Joe. It might just give the average Joe that courage to say, I'm not okay either. And I think I could really benefit from talking to a psychologist or a mental health professional.
Yeah, I think you just spoke to something I was going to, ask you about. But as far as limitations when working with athletes, and as you mentioned, confidentiality is one, and just the stigma is another. Can you name others that impede treatment sometimes?
Sure. And I think that, in terms of confidentiality, oftentimes when I was doing a lot of the sport work, I was observing athletes, on the field and, going out to their turf, so to speak. And so you're out in the public, you're out in the open. And sometimes we do that in clinical practice as well, with various exposure interventions. And, when that occurs, we need to be careful. We need to make ourselves a little bit more discreet and kind of hide off in the background. But that, and also sometimes, I might be on the bus traveling with the team. Whenever possible, I try to travel separately just to not blur that boundary. But I know of a lot of consultants and even sports psychologists who do travel with the team. And so even something like that, when you're sharing, sharing that space with the team and the athletes, when you're not really necessarily doing your actual work, that can also have implications for boundaries. So I would say that is another challenge as well. I think for me, being female, my experiences in working with, I've worked with a couple more male dominant sports. And so sometimes there is still some of that stigma surrounding gender, and just, what's this girl going to teach me about, sports psychology? Or what's this girl here? What's she doing on the field? And I think that, I had a situation arise, and actually it was when I was a practicum student. I wasn't even licensed. And one of the coaches spread a nice little rumor that I was there to provide massages to the team. And so, I basically took all of the coach. I mean, and I was pretty gutsy in my younger year, but I lined up all the coaches, and I basically said, it's been brought to my attention that the players are under the false assumption that I'm here to give them massages, and I said, I just want to reassure everyone that that is not my role here at all. I'm strictly mental skills training. We're going to be working on aspects related to improving their focus, their goal setting. And so I named the specific skills that I was going to be addressing. And I basically said, the massages are not a part of this package deal, essentially.
Wow. So as a female a future aspiring female clinician, I want to thank you, because I think you set that precedence. Whether you call it gutsy, but that's very admirable, and shows that women can have competence in a male-dominated field. So thank you for that.
And I shared that story because I was still a student then, and so I think that, it's one of those things where, obviously I consulted with my supervisor before, approaching and, kind of practice what I was going to say. But I also think that it's something for, aspiring sports psychologists, aspiring sports psychology consultants, aspiring clinical psychologists to be aware of, that these situations can occur at any level of our professional practice. When we're novice newbies to being a seasoned professional, we can be challenged or marginalized or discriminated against because of an aspect of ourselves. And in this case, for me, it was gender.
Oh, wow. Absolutely. And just to veer off a little bit, what would you say in your experience in working with athletes has been, a common issue that you come across time and time again?
I mean, because I see things more clinically, I guess.
Clinically,
yeah. So, I think that, what I found is that if an athlete has performance anxiety, most of the time, at least in my clinical experience, they also have some other form of generalized anxiety. My experience in working with athletes is that it's not just sport specific. And I think some of it, though, is probably the population that I draw, because I am trained as a clinical psychologist. But for me, what I found is that it's very rare that the anxiety only occurs on the court or on the field.
Yeah. And I know there's no prescriptive recipe for an athlete, right? But what are some factors that you think are linked to performance, to high performance?
Well, I will say that a lot of the sports psychology literature talks about these components of quote, mental toughness. And really what we're talking about is motivation, focus, confidence, and composure or pressure tolerance. And what I find to be very interesting is that these exact components of mental toughness we also find in clinical work as well. And so a lot of times it's how can I stay focused? How can I ignore the noise? And when I say ignore the noise, I mean ignore my mind chatter, ignore the spectator in the stands, ignore the person behind me who's heckling me so that I don't get a hit, So all of those techniques, I think, are hugely important. How can I basically shut the outside world off so that I can maintain my focus in the moment? And actually, Kathy, as I'm explaining this a little bit more, I actually am thinking that if I had to pick a trait that I think really sets an athlete apart, it's that ability to shift focus of attention seamlessly. Because sometimes the focus needs to be more broad and external, and sometimes it needs to be more narrow and internal, or sometimes it needs to be more narrow and external. And so an athlete being able to switch through all of those domains of attention effectively, I think really makes them a great athlete.
Wow. And would you say that that's an innate ability, or can that be cultivated?
I think that's something that can be worked on. Absolutely.
Okay. And that's where you would come in and
Mm-hmm.
implement some of those interventions you
Yeah.
talked about.
Yeah. And like, I'm realizing that like through my terminology, it might be helpful to have more of a concrete example. So, so let's take a baseball player, for instance. And that what I mean by shifting attention is they're going up to the batter's box, for instance. Okay. And so when they're first walking up, their focus needs to be narrow and external because they need to be paying attention to physiologically what's going on with them. And then it needs to shift to narrow external because the pitcher is going to get ready to throw a pitch. Okay. And so then from there, like when they swing and they notice they get a hit, then it needs to be more broad and external. So that's a very concrete example of how attention needs to be effectively shifted. And I'm noticing I have a couple of comments. So first of all, hi, Maggie. Good to see you on here. And then there's another question. Okay. From a sport motivation factor, do I have tips for self-talk that help reduce the focus on the inner voice? Okay. Great question. So I will say you need to identify if the inner voice is a critic or a cheerleader. That's the first piece, because arguably, if the inner voice is a cheerleader, it could be beneficial for that individual. My favorite statement to make to an athlete, or really a client in general, is that if their self-talk isn't motivational or instructional, then it's detrimental. So particularly from a sport performance perspective, our self-talk should serve one of two primary purposes, and that's either to motivate or to instruct. Mm-hmm. Now, early on, when an athlete, for instance, is just learning a sport, they're going to need more of that instructional self-talk, maybe to cue themselves, for instance, as they're going up to a putt. But then as they get further along, they're going to need that self-talk to be more motivational. And so I will literally say to athletes, what are you doing to cheer yourself on? What are you doing to keep your head in the game in an adaptive, healthy way that's facilitating your optimal performance? What are those things that you're doing to get in your own way? And so that's oftentimes another form of assessment that I'm doing is I'm assessing their self-talk. I'm assessing particularly what happens in critical moments of the game. Okay, so you just missed that shot. What's the first thought that pops into your head as soon as that shot is missed? Okay, all of that is very helpful data for me in terms of then the direction that I need to go with an athlete.
Wow. Can you share what's been the most rewarding aspect? I mean, it sounds like what you're describing sounds pretty rewarding. But do you have a specific example?
Sure. Well, it's interesting because now I'm spending more time in the classroom with you all than I am out on the court or out on the field, or even in more of a clinical setting. But I think for me, one of the most rewarding aspects is when you see an athlete have that aha moment where it just sort of clicks, where you know that because of the time that you've spent with them or whatever it is that you've been working on, it finally just clicks and sinks in. And that's just very rewarding and gratifying to watch. I think, it's also very rewarding when, and I've had several times when athletes have come up to me and said, oh, remember like in the last session when we talked about this particular strategy, I was able to implement it. And gosh, you're right. Like I mentally beat myself up. I'm awful to myself, and now I'm really working hard to cultivate self-compassion, self-cheerleading, self-motivation. And so those are some of the more rewarding aspects. I also think for me, because I am so person-centered, the relationship that I have with my athletes and teams is probably the most rewarding part of the work that I do. And I would say that same parallel holds true for me in the classroom with my students and teaching. I think that as psychologists, our primary objective should be, cultivating those relationships and really connecting with people and, finding a way to help them, feel more empowered. I feel like as psychologists, we're kind of in the business of human empowerment. There's that quote from Wizard of Oz, Oz didn't give the Tin Man anything that he didn't already have. And so, I think that it is absolutely wonderful when you see a client, an athlete, recognize something within themselves that they forgot about, or they rediscovered in a new way, or got excited because it was in there and they never knew they had it.
Wow. What an opportunity Midwestern has to start a sports here and have you. And I hope Steve got that aha moment that you're describing right now when you answered his question. So how does the general audience or the average athlete go and get access to a sports psychologist?
So from a more practical standpoint, I would say, just like within the clinical realm, we encourage our clients to look on Psychology Today. There's a Find a Therapist link on Psychology Today. On my Association for Applied Sports Psychology, there's also a Find a Consultant link as well. But I would say that, and this is where it's important that, there's not misinformation being spread, because if an athlete needs a clinician, they should really be seeking out a clinician. So someone like a licensed clinical social worker or a counselor or a psychologist, if they're seeking more of that sport performance enhancement piece, they would be in great hands going to the Association for Applied Sports Psychology website. So there are all kinds of resources available out there for athletes to be able to locate a good provider. Let's see, it looks like I have a couple of other questions. Okay. All right, Maggie, good question. What would I say to an athlete who is struggling with their relationship with their coach? For instance, that their coach is too hard on them. Okay. So, that's a very interesting question, because that relates more to some of that role conflict. And so what I would say to an athlete first is I would ask specifically, like, what is it about the manner in which the coach is conveying this message to you? Because it's oftentimes not the words that are being conveyed, but the manner in which the words are being conveyed, right? And so I would want to find out, okay, what's the actual message, and maybe what's the emotional tone of that? I know that I talk with the athlete, and then if, in my professional opinion, I actually think that the coach would benefit from some training, I will actually do some coach education where there's an empirically supported approach to coaching. It's Smith and Small's Mastery coaching is what it's called. And so basically it takes principles of motivational interviewing, essentially, and even just more of that affirmation compliment sandwich approach, where we really encourage coaches, like, if you're working with a team, how are you affirming them? How are you building them up? What's the constructive feedback that you're giving them? And then what's the plan moving forward? So Maggie, depending on my relationship with the coach, I might actually go and have that conversation with them in terms of just doing some basic psychoed on this mastery approach to coaching. If I feel maybe like the particular athlete is maybe being singled out, I'll want to explore, okay, is the coach just trying to push them harder because they're really invested? But then it gets more complicated, right? Because what if the athlete has maybe some personality characteristics where they don't have a tough skin, or they're highly self-conscious, or they might get overly anxious? How do I navigate and manage all of those things? And so I'm going to be doing a lot of assessment, both with the individual athlete, and then I'm also going to be observing the coach to see, okay, what's really going on, what's really at play. But great question, Maggie. Did I answer it for you? And I would say that also is one of those sticky factors that will oftentimes occur in sports psychology work, where you don't want to step on the coach's toes, right? Well, and that's the thing. You want to have a good collaborative working. You basically want to have a good collaborative working relationship with the coaching staff, with individual athletes, with the team. And I think that's a whole nother piece that, my clinical training and background has really helped me with, in terms of there's a unique dynamic that occurs between me and the head coach. There's a unique dynamic that occurs between me and the head coach and the coaching staff. There's a unique dynamic that occurs between me and the captain of the team. There's a unique dynamic that occurs between me and each member of the team. And then there's a unique dynamic that occurs between me and the whole team. And, when you look at multiple personalities, multiple preferences, multiple values, multiple communication styles, it does become increasingly complex.
Yeah. And is there anything we can do or if we are athletes, or not we are athletes, but if we know of an athlete who is struggling, are there signs or things we should be looking for?
Again, I always defer back to my clinical training, in terms of common signs or symptoms that somebody might be struggling: change in personality, withdrawal, isolation, change in mood or affect, either becoming more verbally expressive or angry, or withholding and not becoming expressive, particularly for somebody who's extroverted. So some of those changes can really signify that an individual is struggling with something. I know Dr. McNeil a couple months ago talked about his expertise area of eating disorders. And that's also something that I need to be cognizant of as a sports psychologist, because in a lot of the sports, eating disorders are quite prevalent. And so that's something where, there are some behavioral signs and indicators, drastic weight gain, bruising on fingers from inducing vomiting, thinning hair. So there are some physical symptoms that could potentially be indicating an eating disorder as well.
Yeah, I mean, we're getting here close on time, and thank you so much for that. Before we end here, is there any myths that you want to dispel about athletes that you would like the audience to know?
Yeah, I mean, I think the biggest message that I have is that athletes are humans too, and to put them on a pedestal that they're superhuman, I think is actually somewhat dehumanizing to them. That we're not recognizing the humanity in them if we're really treating them as something different than human beings. And so I think that's really where having more of that person-centered humanistic approach can be really helpful, especially if they are an elite level athlete and they're in the limelight, and there could be some shame or embarrassment associated with coming forward with some of their mental health issues.
Yeah. Is there anything we can do to help alleviate some of that distress?
Yeah, I mean, I think education, advocacy, the standard approaches and strategies that I consistently talk about in the classroom, those also apply here. Really using that person first language, not that borderline, not that schizophrenic, but, individual with schizophrenia, individual with borderline personality disorder. So putting that humanity first. And then when we recognize that somebody's not, just, gently educating them on that, because people don't know what they don't know.
Well, thank you so much for your time and the work that you do. It's an integral part of our society. Sports is very much ingrained in American culture. So thank you for everything you do and your research and taking the time to do this.
Of course. Thank you, Kathy. Bye, everyone. Thanks for joining us.